Muito bem, meus amigos, sejam todos muito bem-vindos a mais um episódio do Endodontia Talks. Você já sabe, nós somos o ponto de encontro semanal do endodontista brasileiro. Senhoras e senhores, eu não consigo esconder o meu sorriso aqui nessa cara de bolacha, porque este episódio 59 está maravilhoso. Eu tenho aqui um convidado, o primeiro convidado internacional do Endodontia Talks, 59 episódios depois, e nós preparamos algo realmente muito especial. E sem mais delongas, sem demora, eu quero apresentar para vocês, senhoras e senhores, simplesmente ele, o inventor da lima reciproque, há 17 anos, em 2008, provocou um choque, uma grande revolução na maneira como nós, endodontistas, fazemos a nossa mecanização, a nossa instrumentação. Então, vamos lá. Senhoras e senhores, Ghassan Yared. Hello, Dr. Ghassan. Please be welcome to our home here, to Endodontia Talks. We are nowadays the first podcast more listened here in Brazil about endodontics. So be welcome here.
Thank you, Vittorio. Please call me Ghassan. I will feel better if you call me by my first name. No,
Okay.
I do understand a little bit of Portuguese. Thank you very much for the introduction. That was
You have been here in Brazil, right?
I've been there like 6 times, I think. Yeah. So thank you very much for introducing me. And I'm very happy to be here. And I also look forward to seeing you later during the year. So
yes, that's true. We're going to talk about that. Professor Ghassan will be here in Brazil in person, 13 and 14 June in the city of São Paulo, and we'll discuss this later in this interview. Ghassan, first of all, before we dive into your incredible contribution with the reciprocating movement back in 2008, I want to the audience to get to know the Ghassan Yared person. Who is Ghassan Yared?
Oh, that is probably the most difficult question to answer. Well, I am a clinician like you, like the audience. I am an endodontist. I am also teaching right now. I'm a visiting professor at the University, St. Joseph University in Beirut, Lebanon. I'm interested in research as well, and I lived 20 years in Canada, in Toronto, where I was also teaching and practicing. Mainly, I'm someone who likes to share my knowledge. I learn from other people. Also, by sharing, I learn. And simply, this is it. I'm a simple person.
That's very nice to hear. And Ghassan, you were born in Lebanon, right?
Yes.
Can
Correct.
you tell us about a little bit of your childhood? How was your childhood, and mainly, what led you to pursue dentistry as a labor, as a profession?
Well, initially, I did not want to be a dentist. Like, if I remember well, initially I wanted actually to join, if you know, the Cousteau team. He's a French mariner, a diver. I wanted to join that team, but then I did not. And then I wanted to become a pilot of a jet fighter. But my dad did not want me. He was in the army. He didn't let me. He said, no, not something I should do. And I wanted also then to do to study medicine, but then I thought it was like too long. In Lebanon, normally, at least at my time, during that time, you could be either a doctor, a medical doctor, or a dentist, or a lawyer, or an engineer. So I looked at those and I thought dentistry is probably the shortest. And I wasn't really that great in math to become an engineer. So that's how I chose dentistry. I did dentistry. And then when I finished, I wanted to specialize, and endo was not an option for me at that time. Actually, I wanted to become an oral surgeon. So I applied to study oral surgery in Canada, and I got accepted, but it was too expensive for me to go there, so I did not go. My second topic of interest was occlusion. So I went to France. There was a program, specialized in occlusion, and I started that program. 3 months down the road, Pierre Machtou, he is a professor in endo. He gave us a course on endo at that occlusion program, and I liked that course. And then he convinced me to switch from occlusion to endodontics, and this is why I am here now with you.
We are so glad. The word thank you that you have chosen endodontics instead of other specialties, because it
Thank
has
you.
contributed so much for our specialty.
Thanks, Vittorio.
Ghassan, we know that an innovator's career is never a straight path. Never, never, never. Do you remember a particular challenging moment or a specific hurdle that you suffered in your journey? And how did you overcome it? Such difficulties?
Actually, no, I don't think there were any major challenges, to be honest with you. Not at all. I'm sure there were some minor challenges. Whenever you think of an idea and you want to try developing that idea, there might be some challenges. But honestly, there were no major challenges. Maybe one of them was to see how to develop that idea, with whom I could develop that idea. So would I do it on my own, or would I do it through the university or with a dental company? So most likely that was the major challenge. But even at that time, it was not really difficult to know where to go. It was easy for me, to think about manufacturers. We're talking about the idea. Actually, I started the idea in 2001. So in 2001, wow. Yes.
7 years prior.
Before, yes. So 2001 for me, it was, Dentsply. At that time, now if we want to buy real estate, we say location, location, location. At that time, for me to develop an idea, it was Dentsply, Dentsply, Dentsply. This is how I ended up, doing reciproc and wave one with Dentsply.
So that was probably... That's right. You developed wave one as well, not just
reciproc. Both are based on my idea, of course. Yes.
Wave one gold is one of my favorite in my practice.
Not mine, obviously, as you know, because it is a little bit different to reciproc, but it is definitely a good system. So there were no serious challenges. Just a little bit some of the hurdles, very easy to manage.
Of course. Okay. Outside of the dental office, do you have any hobbies, any passions, anything you're passionate about? I know you are a very busy person, but you try to have a life outside.
Yes, of course. Yeah. Well, right now, actually, I'm not really practicing anymore. I just do some charity work in Lebanon, so I have a lot of time. So I travel quite a lot. Sometimes I try to play some music on the saxophone.
Saxophone. I play saxophone as well. Alto saxophone.
Oh, do you? Okay.
We have to play together.
Me too. Yes. And winter, if I could, I would go snowboarding. This year I was not lucky because I was in Lebanon before coming to Germany, and it did not snow at all because I love snowboarding in Lebanon. So and summer I beach. So these are the things that I like to do.
We have great beaches here in Brazil.
I know. Yes.
very interesting that you done charity jobs in Lebanon. Can you detail a little bit more of this charity in Lebanon?
Yeah, I have two friends who are general dentists, and then they have patients who cannot afford paying for a root canal treatment. So I go there, do the treatments, not the best conditions. There are no microscopes, just loops. But that is enough for me, I keep my fingers wet. Patients are happy, they're not paying, and my friends, dentists, are very happy because they don't have to deal with the root canal treatments.
Of course,
So I basically do like 3-4 treatments every week.
Such a noble work. Congratulations for that, Ghassan. Such a noble work.
Thank you.
If you could give you one piece of advice to your younger self, Ghassan, when you were just starting in dentistry, with your experience nowadays, what would it be? This piece of advice to your younger self.
To myself?
Yes, to your younger self. If you could give you a piece of advice.
Yeah, just do things with a lot of passion and to the fullest from the beginning. Don't hesitate.
Don't hesitate. I love that because
yes,
I have one experience in my life. Do not hesitate in my progress.
When we're young, we hesitate. We ask, we wonder, should we not? So if you feel it in here, then go for it.
I love that. I love that mindset. Ghassan, now let's dive in the topic that I am sure that our audience is have very curiosity to know about the invention of the reciproc. Okay, so let's dive in this topic. How did that idea came up back in 2001? Because back in 2001 we had ProTaper Universal, we had Profiles, we had K3, maybe Cyber. But how did you came up with that idea?
Are you sure you want me to talk about this now? Because I'm going to speak about this at my lecture.
You can give a little tip.
No. I'm joking. I'd love to talk about it. I always this is something I always like to talk about and tell the story. Actually, I started thinking about this in 1999. This is when I started thinking about reciprocation itself, and everything started with the article of James Rohn on the balanced force concept that was published in 1985. And for those who are not familiar with the balanced force concept, so James Rohn showed that we can use stainless steel manual instruments and in manual reciprocation to prepare severely curved canals. And he used file size 45 and 50, so very rigid instruments, and he had very good results in severely curved canals. So from that study, I understood that reciprocation is important, for the shaping of curved canals. And 1999, we were already into nickel titanium. So I thought, if we could do this with hand stainless steel files, rigid ones, so it should be even easier with nickel titanium because they are more flexible. And at the same time, that in the mid 90s, my research was mainly on motors. So I was assessing the parameters of motors that used continuous rotation. And companies were sending me motors to test. And one of these companies was ATR in Italy. They sent me an ATR Technica to test the rotary motion and all the parameters associated with continuous rotation. And when I saw the motor, I saw that I was surprised, it had a reciprocating feature. So that made me very happy. At that same time, I was starting to use the ProTaper instruments. And I knew that they could cut in both ways in reciprocation. So I thought, I have a reciprocating motor. And in my head, I had the concept of James Strong, so reciprocation. I had instruments that could work in reciprocation. And I was using, the series of pro-taper instruments in continuous rotation. So I thought I would try them in reciprocation. So I tried the whole series from SX to F2 in reciprocation in resin blocks, and it worked. I changed the angles on the ATR Technica, and then at the end, I was able to use the whole series to prepare a curved canal in a resin block. And then, I thought I would want to make the procedure simpler because, I am a clinician. I was teaching. I saw, my students struggling mainly with the hand filing and then with these long sequences. So I thought instead of having the whole sequence, used to get to an F2, I wanted to reduce the number of instruments, and I did reduce the number of instruments. And at some point, I found that I could prepare that J-shaped canal with only one F2 instrument. Pro-taper used in reciprocation. So that was around year 2000. And the first video I did of this with a pro-taper used in reciprocation was in Toronto in 2001.
How did you get in Toronto, Ghassan? How was the connection between Lebanon and Toronto, Canada?
I wanted to leave Lebanon because of the war in Lebanon, and there was a position, available, teaching position available in Toronto. So I applied to that position, and I got accepted. So I went to Toronto.
Of course. And
so 2001. So I did that video, and then I switched to using the F2 pro-taper in my practice in Toronto in reciprocation. So since 2001, I stopped using rotation. And then I contacted Dentsply to see whether they would be interested. So I went to my fair in Switzerland. I showed them this, and then everyone was there. They saw what I could do with the F2 pro-taper, and then everyone left the room and no one said a word to me. That was also in 2001. And I waited. Few months, few years, they did not get back to me. And then I got fed up. And I published an article on the use of pro-taper, F2 pro-taper in reciprocation in 2008. When I published that paper, that was in May, Dentsply contacted me again and said, let's work on that. I wanted to have something better than F2 pro-taper because the F2 pro-taper, I frequently had to use hand files number 8, 10, and 15. I wanted something that was more efficient. And this is why, reciproc was developed.
Ghassan,
that's the story.
It's so beautiful. It's so remarkable to hear that because you mentioned a principle of entrepreneurship. That is the main reason that we entrepreneurs exist is to solve problems. And you observed a very common problem because the people was tired to have long sequences of files to achieve the ideal shape of the canal and then to obliterate that canal. So that's remarkable. And the second thing that made me goosebumps here, because you were patient and you were patient and passionate about your idea. So you waited 7 years, and I have I have a small experience with the Dentsply of pressuring them, because when I went to vacations with my wife back in 2019, I had to write about 20 emails. So they let me to visit the factory, and again,
yes.
I got the visit. So I'm glad to hear that you are so passionate and so patient to see the realization of your dream, of your idea.
So going back to the question that you asked me earlier about the challenges, that was the biggest challenge, waiting these years in order to be able to do something about it.
I'm so glad
But everything ended
our
very well.
audience, of course.
Yes.
I'm glad to hear you saying that, because the audience, I'm sure, I'm completely sure that the people that are hearing and watching us today, they will be inspired, of discouraged to wait.
Yeah.
Discouraged to wait.
Yeah, we have to be patient. And to be honest with you, actually waiting these few years were not that bad, because while waiting, I had more experience with the F2 pre-taper used in reciprocation. So when I started working on reciproc, I had a very clear idea in my head of what I wanted. And actually, the work that I did during the past years helped a lot in developing reciproc very quickly.
No, wonderful, wonderful.
Yes.
It made me goosebumps here. What a story! What a story! What a story! Thank you very much for sharing this to us.
My pleasure.
We know innovation never stops in endodontics. With your experience, what we can expect for the future of endodontic instrumentation nowadays?
Well, with respect to management of canals, I think there's still a lot to do. So, in my opinion, based on my experience and based on the science that I see about, management of infected canals, I think we will be heading to a non-instrumentation technique. However, also based on my experience and the science and the history, and non-instrumentation, it cannot be a pure non-instrumentation technique. We can have a non-instrumentation technique for canals that are medium size or large canals, whereas in canals that are quite calcified, we still need to have a minimum space. So for me, this is where we will head. I don't think we will ever be able to do a pure non-instrumentation technique for all of the canals. Non-instrumentation was first developed in 1985 by Lucy in Switzerland. Imagine 40 years ago. And since then, no one was able to have a pure non-instrumentation technique. And that was for a reason. We will always need some instrumentation for these very narrow canals. However, non-instrumentation means the irrigation protocol will be different and the obturation will be different, because when you do not instrument or when you barely instrument, you cannot obturate anymore the way we do right now. And the irrigation has to be more effective. This is why, there's this triad, instrumentation, irrigation, disinfection, and obturation. So the focus mainly will be on the irrigation and the obturation, less on the instrumentation, because when you instrument a little bit, you can instrument with anything. What matters then are the irrigation and the obturation. Now, for irrigation, for me, it's obvious that whatever we have so far, whether it is sonics, multisonics like the gentle wave lasers, although these are fascinating, technologies, but these technologies did not improve the outcome. And
That's
for
true.
me, in a way, this is where these technologies stop. And right now I'm working on heating sodium hypochlorite and activating it in the canal, because I truly believe there is a great potential that no one has yet explored in the intracanal heating and activation of sodium hypochlorite, activation by either ultrasonic or sonic. But what is important is the heating of sodium hypochlorite, mainly with respect to non-instrumentation. I did not, I did not invent the intracanal heating and activation. It was Alfredo Iandolo from Italy, but
It could be the next invention, right? It could be the next invention. of yours.
Oh, well, that is coming. That is coming.
Okay.
That is coming. So what Alfredo did, he developed this procedure as a final irrigation protocol. I took it one step further to be able to do non-instrumentation. So right now, medium-sized canals and large canals, I don't need to put any instrument in them. I just irrigate, heat, activate, and that is it. But of course, that requires a different operation technique, which also I'm developing. So I think this is where we'll be heading in endo. That is one. Second, path in endo is being more conservative with respect to what we do with the pulp. I think we'll get to a point where what we consider as an irreversible and symptomatic pulpitis can be treated without having to do a root canal treatment or even a pulpotomy.
That's a very, very
okay.
idea.
So
Very
there are already studies that show the effectiveness of pulpotomies on teeth with irreversible pulpitis, symptomatic irreversible pulpitis. I take it one step further. I think in some situations, specific situations, the use of steroids can be very efficient in rendering what we think is irreversible in making the pulp healthy and normal. And what I'm saying here is based on my clinical experience that I developed during the war in Lebanon. There are patients for whom I could not treat. I only gave them, a steroid, dexamethasone, to relieve their pain. And many patients had later a normal pulp, at least according to testing and according to radiographs. So I think there is a great potential in the use of steroids in specific cases to render a pulp that is irreversibly damaged, as we define it, to render it healthy and normal, at least from a radiographic perspective and from a clinical perspective.
I am very, very curious to see you in person talking about this specific topic here in Brazil. I see, as you see, that will be very, very innovative, very, very innovative,
Yes.
very different of the usual that we do, because usually we open those fees, right?
Yes, of course.
Of course.
The problem is that ideas come much faster than the research.
Yes.
It's like reciprocal. The idea was there, but no one was able to have it. No one had the mindset at that time to think, oh, that might be interesting. And the same for the use, for example, of steroids in specific cases. Like if you talk about this to researchers or at a university level, like they won't get it. This is why ideas are usually they come very early and research is quite late, and that can be a problem, especially nowadays where we are heading to more evidence-based dentistry.
Ghassan, by the time 2008, let's talk about a little bit more in this specific topic. Did you realize that your invention would have such a great contribution, such a great change of paradigm of the way endodontics? Did you have that idea?
Yes, of course.
Will change globally, endodontics globally?
Not in 2008, even at the end of 2001 and 2002, because at that time, as I said, I started using F2 protaper in reciprocation. And the more I used it, the more convinced I was that this is something that will change endodontics. I knew that, that it changed my way of practice. Imagine, like in 2001, I told my assistants, I don't want the protapers. I want only the F2 Pro taper. So for me, that had a major impact on my practice. My assistants were very happy because much less work, and also as a clinician businessman, much less expensive for me, because instead of using the whole series, I was using one instrument. And in Canada, we're not allowed to reuse the instruments. So instead of reusing the whole series of Pro tapers, I used only one F2 Pro taper. So yes, from the beginning, I knew that would have a great impact.
A major impact, of course.
Yes.
And how was the feeling? That incredible feeling of, wow, I managed. Yes, the word accepted the idea. Then Sply opened the door for me. How was that feeling?
Well,
I finally win. I finally won this.
Actually, that was not the best feeling. Actually, the best feeling was when, like at the beginning, again around 2002, when I knew that this is it. That is one. And the second best feeling actually I had was when we started working on the reciprocal prototypes. The last prototype, I took it home and I gave it to my son. At that time, he was 2009. He was 12 years old. I showed him how I use reciproc in a resin block. I gave it to him, like without anything, he did it. I knew that was great. I knew, because he was able to do it, I knew that will be a great instrument. So for me, that was the one of the best feelings I had.
To see that if your son was capable, the endodontic students will be too, right? That was
yes. Yeah. Well, I learned to play the saxophone at 30, or I was 30 or 33 years old. When I took it for the first time, I blew in it. I couldn't have any sound at all. I gave it to my son. He blew in it. He was still very young. Like from the first time, he was able to produce a sound.
Make music, to play.
Yes. So I thought, me as a clinician, if I can do this, and if he was able to use reciproc, so dentists who are not really experienced will do well.
No, I can imagine your feeling and to see your invention around the world. And still about this topic, how did your life change it after that? I imagine you started to travel a lot, right?
No, not really. No.
So to speak about reciproc in conferences for
traveling, not that much. No, because with Nestfly I used to I used to give 3 or 4 lectures a year, so not many lectures, which was great because I didn't have to travel that much. Nestfly, like any other company nowadays, they have what they call train the trainer. So I train other clinicians, and other clinicians they teach. So I didn't have to lecture a lot about reciproc, which is good also because frequently dentists or teachers prefer to have what they consider an unbiased opinion. So if I were to give a lecture, they may say, "Oh, he's biased," which I understand, although I'm not. I'm really very objective. So respect to lecturing, no, I didn't lecture that frequently. The biggest impact was on my practice.
Your practice,
yes.
Grew. The
endo practice. Yes. Because I was able to reduce the number of the length of the treatments, so I was able to see more patients in a day. I was more efficient. So I was spending less money on a treatment compared to what I was using before. My assistants were extremely happy. Whenever I took a hand file, my assistants knew that was a difficult case, and they were like, "Oh no, that might take some time." So the biggest impact was on my practice.
Your practice.
Yes.
Of course. Do you see yourself retiring, Ghassan? Do you have plans of retiring?
Well, anyway, you can say I'm semi-retired. I don't see many patients anymore. But no, this
story, right? The story work.
this will not retire.
because you keep your hands busy in the cherry, right? In Lebanon.
Yeah. Yes.
Of course. Ghassan, if you had to highlight one lesson that your career in endodontics has taught you over the years, what will it be?
Sorry, can you repeat the question, Vittorio?
Okay, if you had to highlight one essential lesson, just one lesson of your career over the years, what will be this lesson? I'm asking you this because we have in our audience of the podcast, we have more experience and more beginners in endodontists. So
yes.
what was the lesson? You'll give it to
very simple. Very simple. Without science, we are merely clinicians. With science, we become health carers, health professionals. So one lesson is to read the science and to know how to read the science and to know how to choose the correct science.
And how a tip about that? How can we choose the best science? How can we separate the best science, the best evidence?
First, we have to read a lot. This is what I did actually. I had to read a lot. No one taught me how to read the science, but I was reading a lot, like really a lot. Everything that was available, I was reading it. And when you read, you start, seeing some problems here and there, and then you are able to select, studies on which you want to concentrate. It's a learning process. It is a learning process that is acquired only by reading. It can also be acquired by being taught how to do that. Like I can facilitate this to someone because of my experience, but you will not find, individuals who are able to do that. And that takes time. So this is why most likely for the general, population, it will be reading, and by reading all the literature, almost all of the literature about endodontics, you'll understand, you'll see, the gaps, and you'll see where there are problems. So it is a learning process. Very difficult, but it is essential. It is essential.
Of course. Thank you very much for that, Ghassan. Now I want to engage a little bit our audience about your course here in Brazil. Just a little tips. And as I told in the beginning of this episode, you will be here in person, June 13 and 14 in the city of São Paulo, teaching an exclusive course, an immersion about advanced endodontics. Can you explain us a little bit this 2-day course, how it will be? Theoretical, practical, both?
Well, it will be both. So theoretical, of course, quite advanced with respect to clinical applications, and quite advanced with respect to science. So every time I talk, there is always, I support what I talk with science. I will not overwhelm the audience with the science, but there are articles that are important for everyone to be aware of. And actually, going back to that question that you asked me about how to know which article to choose, I will choose a few articles where I will show, the problems, that the flaws in the methodologies in these articles, and that actually would be a great starting point for someone to learn how to choose a good article. There are details that we would never think of, but details that are very simple to see if if we focus on them. So definitely theoretical part that I think will satisfy those who are less experienced to those who are quite experienced, those who are not very interested in science to those who are very interested in science.
Wonderful, wonderful. That's amazing.
Then definitely there will be the workshop. The workshop will be that's great about the use of reciproc, mainly in challenging canals, so curved canals, narrow canals, MB2 canals. I insist on the MB2 canals because until now, whenever I do an MB2, I'm still like wowed by reciproc. So and I think those who will be able to try reciproc in an MB2 canal will appreciate very well the benefit of reciproc.
Of course, wonderful. In this moment, we are recording this podcast. We just have 6 spots available for this course with Professor Ghassan Yared. So, Ghassan, can you leave a special invitation here right now to the colleagues that will be benefit of one of these 6 spots left? Can you make this invitation?
Oh yes. Well, I invite you to attend, to register and attend, and I promise you will not regret it. You will learn a lot, and it will be a very pleasant experience. You'll be very surprised by what you will learn, and I'd be happy to meet you there because I will also learn from you, because I'm pretty sure you'll have challenging questions, and to answer those questions, I will learn as well at the same time. So I hope to see you there.
Thank you very much. Ghassan, we are finishing this episode. Again, many thanks. You are such a humble person, such a simple guy, but I admire you even more right now because of your spirit of entrepreneurship, of courage, of determination, to not throw the towel, to wait, courage to wait. This is the main sentence for me, particularly for me. Maybe I hope for the audience too. You actually had courage to wait to see your idea came to life. Yeah, your idea to be real. Your idea to be touchable.
Yes,
be touchable. And I know you have so proud of what Reciproc have became nowadays. So in this moment, we are finishing this podcast, and I want to know if you want to address something to our audience and to make your final considerations here.
Nothing really I haven't said before. Again, it's when you believe in something, just go for it. It may take some time to happen, but at the end, it will happen.
Thank you so much. Now,
thank you, Vittorio.
Thank you to you. Wait just a minute. I will address now our audience in Portuguese. Muito bem, pessoal. Esse foi o episódio 59. Professor Ghassan Yared na casa, no palco digital. Eu ainda estou arrepiado aqui, os cabelos aqui de todo o meu corpo arrepiado de poder ter tido essa oportunidade de trazê-lo para o nosso podcast, o nosso ponto de encontro semanal. Não se esqueça de você rolar a tela do seu celular e você se inscrever no perfil do Instagram do Endodontia Talks, no meu perfil, no perfil do professor Ghassan. E se você está interessado, se você está assistindo esse episódio, pode ser que as vagas, essas 6 últimas vagas, acabem rapidamente. Então, corra, aproveite a chance de você tomar um café, de você estar frente a frente com o inventor da lima recíproca. Professor Ghassan, once again, many thanks. I'm so humbled, so honored to interview here and to have your episode in our podcast, Endodontia Talks. How I told you in the beginning of this episode, today we are one of the principal first episodes more listened about endodontics here in Brazil. So it makes me very humble to have you here. So thank you very much. I'm looking very much forward to welcome you here in São Paulo. I will be there with my family, with my wife, with my child, to welcome you in São Paulo. And I'm very sure that it will be a wonderful moment for those who will participate in your course here in Brazil. Thank you very much.
Thank you, Vittorio. Thank you for everything. And we'll see you.
Ok, we'll see you. E é isso, pessoal. Um abraço para todo mundo. Não esqueça, o próximo episódio será também internacional. Não perca. Teremos mais convidados de alguma parte do planeta. Não vou dizer quem, vou fazer surpresa. Mas é isso. Um grande abraço e até o próximo episódio.